Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
This is Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast where we share the most up-to-date education for healthcare professionals. Welcome to our podcast on school nurse trends, where we're going to spend some time exploring the critical role and responsibilities of school nurses. Now, the National Association of School Nurses reports that there are around 95,000 school nurses across the U.S., and that's providing care to over 50 million students. So to help you gauge this amount, that is about twice the population of Texas. So school nurses really play a vital role in ensuring the health and well-being of students, which is going to directly impact students' abilities to learn and succeed academically. So over these two episodes, we're going to discuss how the role of the school nurse has evolved over the past decade, the primary responsibilities they hold today, and the ways they coordinate care with parents, teachers, administrators, and outside providers. We'll also touch on the biggest health challenges they face, how they manage chronic illnesses, and their role in health education, screening services, and preventative care. Joining me for this discussion is Robin Cogan, a nationally certified school nurse in her 24th year as a New Jersey school nurse. That's amazing, Robin.
That is a long career, but I have to tell you, I'm celebrating my 40th year as a nurse. So,
Wow.
yeah,
Wow,
so
that's,
more than
oh
half of
man.
my career has been a school nurse, but not all of it.
It's amazing that you have, been in this hat for so long, plus being a nurse for 40 years. What an achievement. And still going. And you look amazing.
Well, thank you. Still going
Yes.
strong. Yes, still going strong. I'm not ashamed to say I just had my 64th birthday, so
No, I don't believe you at all. Not at
yeah.
all. Mm-mm. Well, you look amazing, and I'm so thankful that you're taking time to share your expertise and your experience, not just, as 24 years as a school nurse, but I mean, you have a breadth of experience, and so what a privilege it is to talk to you today. Can
Well,
you
thanks for inviting me, and also really thank you for giving voice to school nursing and school nursing practice, a very misunderstood and underestimated nursing specialty. So I'm excited to have this conversation today.
Absolutely. And I agree with everything you're saying. You don't hear a lot about school nursing, and a lot of nursing students don't look at the area of school nursing. It's not really talked about in, nursing curriculum. And when they're going through nursing school, it's, usually, "Well, how can I get in the hospital?" So I'm really excited to learn about school nursing because I don't have a lot of experience with school nursing either. So I'm curious how you got started in this area.
So my journey to nursing and actually to school nursing is not a typical route. Prior to becoming a nurse, I actually studied art therapy. And when I was in my program, there was a practicum part of my program. And in my practicum, I happened to be in a general hospital on a psychiatric unit. And at that time, which was 1981, there was a group of nursing students that were coming through my inpatient psych unit where I was the art therapy intern. And it just so happened that one of their colleagues was an inpatient on our unit when their entire group of nursing students came through to do their psych rotation on that unit. And it was a fascinating experience. It probably wouldn't happen today because of HIPAA and privacy, but at that time things were quite different. And it made me realize that I was missing a lot of information to be able to help patients. And so I had to make a decision at that time for furthering my graduate education as an art therapist or kind of revamping and retooling and going in a completely different direction. And so I decided to go to nursing school.
That is completely different. I mean, that's like on this end of the spectrum from where you were. What made you decide that was it?
I Well, first of all, I did become a psychiatric nurse. I did work in substance use disorder, but I have to
Mhm.
say my background in psych has been the best, series of skill sets that I can bring with me to school nursing. So I don't think my time was not well spent. It's just not a
That
typical route to nursing. I didn't have that calling to be a nurse. But I have certainly enjoyed the decision, but I can say I've made like really clear decisions, even to get my route to school nursing. I'm one of these people, I do like to plan, but I'm also very much in the moment. So when I finally became a nurse, it was 3 years later after graduating from my art therapy program. I quickly went into psych nursing and I loved it. Um, I also was involved in occupational health and case management. So I really was exploring different aspects of nursing. And I ended up, for the longest period of time, in occupational health. And I worked for a railroad. Actually worked for Conrail. And I loved my job. It was so fascinating and high energy and great responsibility, but the company was bought out by another railroad, and I very soon found myself unemployed, and I had 2 small children who wanted to go to overnight camp. And
Mhm.
so I contacted the overnight camp, and I had a heartbeat and I had a nursing license. They didn't even really talk to me. They just knew I had a heartbeat and a nursing license. And I ended up going to camp with my kids, and all the other nurses at camp were school nurses, and they talked me into becoming a school nurse. So that fall, after this was the fall of 2001, so think about what happened that fall. I went back to school to become a school nurse because in New Jersey, you have to have a certification, much like a teacher, to be certified through the Department of Education. Now, that's very different state to state. It differs widely what the
Right.
qualifications, recommendations, certifications are. But I went back to school, and the first night of my first class, the instructor said, "If there are openings for emergency certification in the Camden City School District." And
Mhm.
so I applied there immediately for an opening for a job. And I was actually called to come to my job interview on September 12th, 2001. So
Oh,
the day
wow.
after
Yes.
September 11th. And, I remember thinking, what am I doing? Like, isn't the world coming to an end? I just remember just having
Mhm.
this kind of out of body experience, but feeling really grateful that there was a place where I could practice school nursing and make it work with my family schedule. And anyway, I have been there ever since. I've been there. This is my 24th school year.
So I just turned 40 this year. So I am
Yay!
close to being like half of what you have already done in your nursing career, just, to put some perspective out there. But it's amazing, what you have done in your 40 years and the vast experience that you just described from psych to art to bring those to the students. Wow. I'm sure that it is a privilege for them to have you. And what a great role model that they
Oh,
have in
well, thank
you.
you. It's been a great ride. It's a fascinating career. And I loved your
Mhm.
introduction because you talked about how many nurses aren't even given an introduction to school nursing during their training, during their education.
Right.
Thankfully, that is changing, I can say. And one of the reasons that's changing, outside of we need more school nurses, but there's a lot of I'm sorry, PEDS experiences that nursing students do not get because of how practice is now and how PEDS, there used to be pediatric units in general hospitals, and that doesn't happen as often anymore. There's much more children's hospitals. And so many times in nursing school, I know I've had this happen in my own health office. We will be asked to precept pre-licensure students so that they can have that pediatric experience. And so that's one way that nursing students find out about school nursing. And the other way, of course, is if they were involved in their own school nurse. If they were lucky enough to have a school nurse in the school where they came from. In fact, I wanted to ask you during your introduction, either you didn't have a school nurse in your school building, or you were just not the kid that went to the nurse.
So I didn't really go to the nurse. I remember we did have a school nurse, but I think she went around to all because the only interaction I really had with a school nurse was when she came in to give a vaccination. And I remember that very clearly because
Right.
I don't like shots personally. And my mama had to come get me. So it was a
And
little
so
traumatizing.
that raises such an important point. First of all, that's one of the reasons, I mean, we'll do it, but we don't like to be the vaccinator in our schools because we don't want to scare the kids. We don't want our
Right.
school health office to be a place of anxiety. It's really a safe space for students. And so that's really interesting that you brought that up. And the other point you brought up that happens all across this country is that you did not have a school nurse all day, every day in your building.
No.
And
Right.
so that nurse, like many other school nurses across this country, travel from school to school. And then
Mhm.
people who are caring for students are most likely unlicensed assistive personnel who don't have, they may have the same level of care and compassion, but they don't have
Mhm.
the same level of training and education and experience. And that's a critical issue.
Right. And I will say here where I am now with my girls, one of their schools has a nurse, the other school has a tech, and I just was reading, we have, so I have one going into high school this year, one going into middle school, and I still have one in elementary. So the middle school, I just read their little note that says that they're blessed to have an LPN. However, they're not paid very much. So they're asking families to donate, like $20, $10, whatever you can donate to help to offset the salary that LPN is receiving to be there. But
But
they have it
and
in
yeah,
house.
but how did you feel when you read that?
Just I didn't like it actually. I
And
felt
and
like,
how right, and how long do you think that person's really gonna stay?
yeah, I don't know. And this is
See,
our
the
first
point of school
experience with
nursing
middle
is that
school.
and right, and a nurse is not a nurse is not a nurse, especially in school nursing, and I
Yeah.
have great respect for my LPN colleagues. We have different levels of training and levels of responsibility, though, and in New Jersey, for example, an LPN can definitely work in a school, but under the supervision of an RN. There's certain
Mhm.
assessment there's certain depending on the Nurse Practice Act state by state that RNs can do, but maybe LPNs are not licensed to do. And so
Mhm.
there are a lot of assumptions made about who is a school nurse, and it
Mhm.
is not always a protected title.
It's
And
not,
so
and I will
no,
say because there was another school that, my other daughter was at, and they called them a nurse tech, and they referred to them as a nurse.
and they're not.
Right. So you wouldn't actually know that if you were a parent, you would just hear, "Oh, well, they're in the nurse's office," or "They're with the nurse." And so you assume, I know I assume that it's a nurse because of the education and training that we have. However, then to find out, well, that's actually a tech. They don't even have a certification or anything.
Specialized training.
Yeah.
No. And so that's one of the misconceptions that happens in school, and there are many reasons for it. Number 1, and I believe the worst reason, is that budgetary constraints. But if we don't prioritize the health and well-being of our children, what should we be paying for then? There's lots
Right.
of things that schools pay for extraneous things that are unnecessary, or lots of maybe unnecessary
Mhm.
levels of oversight that maybe schools can look at those budgets and put them more towards health services. Because if you don't have a healthy school community, your children will not be healthy, safe, and ready to learn. They will not. And honestly, neither will your staff. So it's all about
Right.
priorities. And as we see, priorities shift. And
Mhm.
sometimes I have to say, I don't think parents understand the power of their voice, the power of their presence, the important questions that they should be asking their schools. Who is
Mhm.
caring for our children? What is their background? Is there
Right.
specialized training? What do they receive to be able to work in this independent practice as a school nurse?
Hmm. And how often do parents think of this, except for when they need it? For those that are chronically ill that come in, for those that have type 1 diabetes, for when you actually need that professional to take care of your child is really when we start to think about it. Other than that, it's out of sight, out of mind, I feel like, for a lot of us,
Or if an emergency happens at school and it's your child in the
right?
emergency, right? So that's why doing your due diligence,
Absolutely.
really asking the hard questions is super, super important. I mean, just asking, is there a school in my child's in this is there a school nurse every day in this school? And if there isn't, and what are their credentials? And if there isn't, number 1, why not? And what can we do to change that?
Right. Absolutely. So can you kind of walk us through what are some of the primary responsibilities and duties of a school nurse today?
How long do you have?
Well, we have more things to cover, so but we want to touch on all the things for those who really don't know. Because
Right,
I
right.
really don't know.
It's such a loaded question. It's a really super important question, but it's such a loaded question because I just have to say, you know, I like to put it this way, and this is not hyperbole, but everything that the light touches is part of our job description. Everything. From brand new students who are new to this country, who are coming into our schools to help them acclimate, to get them what they need to make sure they have what is needed to be able to enter school, to working with new families or children who are maybe from the area but have never been in school before, to connecting and working with our families with children with chronic health conditions, to working with students who are medically fragile, to working with students who have complex health and social needs, to working with students who have deeply concerning behaviors that are showing up in school, to working with students and families who are dealing with family dysfunctions that will impact school. Things have changed in the family. Is there an incarcerated parent? Is there a recent separation in the family? Has the family just moved or has the family split up? I mean, all of these things impact what a school nurse will do every day.
Mm.
We provide direct care, we provide emergency care, we take care of episodic events of chronic mental and physical needs. I mean, I could list the things that we do, but we are so much more than our tasks. We connect students and families to resources. We are the great collaborator. The care coordination is a huge part of our practice. We focus under the school nursing practice framework. And within that framework, think of it as a school nurse is kind of embracing all of these aspects of care for her, not just her students, but the families and the school community. And that can be anything from a community and public health concern. We can just say COVID, and I could talk to you for 5 hours about COVID.
Mhm.
Community issues, from social determinants of health, from community violence, from the impacts, anything that the community is experiencing that will impact children's ability to learn and flourish at school, from quality improvement, things that we want to focus on every day, part of our data collection. Our practice is evidence-based, and that takes a lot of time and determination and research and implementation to make sure that we're providing not just the best care, but that our care is based in evidence.
Mhm.
So it's an ongoing evaluation. We are constantly goal setting. We are always learning to professionalize our practice. And then in the community and public health arena, we have to provide culturally sensitive, inclusive, and holistic care to all of our students. From a perspective of, kind of the day to day, sure, we conduct health screenings on every single student in that building, some more than less, depending on the year. We do surveillance outreach. We are the immunization compliance gatekeeper. So those are very important roles that we play. We are always looking to collaborate with community partners to develop and implement partnerships that will bring health services right to our school communities. We educate about health population, health issues, health promotion, disease prevention. We are, and as I say this over and over again, we are the chief wellness officers in our buildings. Even if we don't have that actual title, that's who we are.
Right. Yes, I think you should have that title personally, but
You should be
even though
paid for a chief wellness
right,
officer.
you paid, what you deserve, so to say. But, so I know you talk a lot about that coordination of care and collaboration. So what does that look like with, say, parents, teachers, administrators, and even maybe some outside providers for students?
Sure. Well, the big thing is we are constantly looking for resources that we can bring to our community, not just handing off a phone number, but a
Mhm.
warm handoff that we spend time developing relationships with these resources. So, for example, we would collaborate with families, school community on mental health issues. And that would include if your school's lucky, once again, lucky enough to have these positions, and they should, school counselors, school social workers, school psychologists, and the student's medical home outside of school, their primary care provider, their pediatrician. We work together to develop and implement plans of care for those students that are developmentally appropriate. We want to foster independence in our students and then teach them and teach the families about self advocacy, right? And then we also provide um, evidence based counseling, health counseling. This is so important. When we talk about school health, it's a team, but often it's a team of one or a team of a half, a half a
Right.
full time equivalent. So, what would the ideal team be? The ideal team would be all the things that I just said, working together in collaboration so that we can meet the vast needs of our students, which has only escalated monumentally, not just in the last 10 years, but in the last 5, especially since COVID.
Right. And that was kind of leads into my next question that I had. And that's what are some of the biggest health challenges that you're facing in the student population?
There are enormous health challenges. I have to tell you that prior to COVID, school nurses spent up to 35% of our time on mental health issues. That's only increased since COVID. We don't have the data point for that, but I will tell you, I believe it's closer to 50%. We are
Wow.
Yeah, students are coming to school with the same social and emotional challenges that we see in communities. None of
Mhm.
us, we all carry that invisible backpack of our issues with us, don't we?
Right. We
Teachers,
do.
students, parents, administrators. It's a fallacy to think that those things don't come to school with us. School is not
Mhm.
this magic bubble that doesn't get touched by the outside world. If actually it's the opposite. School is the petri dish for all of those things that then come home to leave school and come home, and it's almost like this symbiotic relationship. So we
Mhm.
need to stop separating it out as if it were separate issues. It's just like, physical health versus emotional health. They are one and the same, right? Being healthy at school should also mirror being healthy at home. And when those two areas of importance don't follow the same guidelines, that's when we get a real disconnection. So, for example, in school, we're seeing students who are very, very stressed, who have tremendous anxiety. We're seeing students who are dealing with depression. They have addictions to things like social media. I mean,
Mhm.
even most recently, the Surgeon General called out what is absolutely true, that the impact of social media is deeply affecting students' mental health. He's even suggesting that a black box warning label be put on social media, that there is an
Yeah.
intentional effort, right, to turn the student into the product for some of these social media companies. And so we're dealing with that. We're certainly dealing with not feeling safe at school. And it won't mean that every school will ever have a school shooting, God forbid. But you know what? Every school has an active shooter drill multiple times a year. And sometimes those drills
Right.
are incredibly traumatizing. So there are these outside influences that absolutely come into school and impact the culture, the environment, how school feels. I think the greatest thing we're dealing with at school, and it's since COVID, is that sense of feeling connected. How can we repair the ruptured relationships that happened during COVID? And there were many. So that's what's
Absolutely.
happening for us now, right?
And I will say that, as my daughters are getting older, I'm seeing how many children are struggling with even communicating with people. I mean, you walk in there and they're on their phone and then they can't carry on a conversation. They don't know how.
They physically,
Mhm.
emotionally, psychologically, developmentally do not know how to communicate with each other.
Yes.
And it is the advent of that smartphone. It did great damage to this country. And yet we live and die by it, literally.
Right.
And so we have, thankfully, there's tremendous efforts out there to pass laws that will protect our kids. But I have to tell you, it's not just the kids that are addicted, it's the parents, it's the adults.
Absolutely. Yes.
I mean, when I send a child home and a parent comes in and isn't even looking at their sick kid, but engrossed in a phone, just I don't know what they're looking at, but it's not their kid, that
Mhm.
tells me that we really have a problem. It's bad enough to go to the grocery store and not say hi to the person checking you
Right.
out because you're on your
Yeah.
phone. But that's what kids are seeing. They're not
Mhm.
learning how to communicate, and they're not learning how to problem solve either. And neither are the parents. So
No.
we have a huge challenge. Like that's why I said to repair ruptured relationships, whether the relationship is within your own family, yourself, your colleagues, your students, each other. Mm.
Right. So I know we talked a little about mental health, but can you kind of talk about how school nurses are dealing with the chronic illnesses like diabetes and severe allergies and asthma? Because now we even have um, a lot of students becoming type 2 diabetics.
Right,
They're not even out of elementary school yet.
right, right. Yes, we have a tremendous health crisis in our country, a crisis of lack of activity. Our children
Goes
have
back to
really
phones
back to
and video games and computers.
right, things that keep kids sedentary. We also have, we don't know our neighbors the way we used to. There's been a real pullback in terms of community activities. I mean, there's sports. There's always sports, so
Mhm.
sports are good. But for those non-sporty kids, we just don't have the same sense of community that we used to have that were built around our community schools. We really don't. It's things have changed dramatically, and I believe personally that some of that is people not necessarily feeling safe in large group gatherings when you think about it. Safe for many reasons. So, um,
Absolutely.
I mean, the other piece of that is that when we look at just the casework, the caseload of what school nurses are doing at school, I think it's important to understand that there's a real disparity between what school nursing coverage in rural schools versus urban schools. Rural schools employ 56% of full-time school nurses. So there's a huge chunk of rural schools that have probably either very part-time or no school nurse at all. And I would bet in those rural schools that was 56% that they had a very large caseload. Now in urban schools, it's a little better. It's 70%, but I know that they have a large caseload. I happen to work in an urban school district. And then regionally, it's vastly different. In the West, there's only 33% of schools that have a full-time school nurse, and I don't know what those ratios are for student nurse to school nurse
Right.
to student ratio. 51% have a part-time nurse, and almost 16% don't have any nurse at all.
Mm-hmm.
The Midwest is a little better. 59.9% have full-time, but 7.5 have none, and almost 33% only have part-time. Northeast, it's a little better. 88% have full-time, 11% have part-time, similar to the South. But this latest workforce study was done in the middle of COVID. And we know, so we're not really sure what those numbers, the actual numbers are,
Right.
because this is a snapshot of a time during the pandemic when there was funding to increase school nursing workforce. We know that once those COVID funds dried out, which was June of 2024, that
Mm-hmm.
many of those positions were going to be eliminated. And that's what we've been dealing with towards the end of this last school year and into the summer. And I know we're going back to school with a lower number of school nurses.
Yes. Well, that wraps up our first episode on the role and responsibilities of school nurses. We hope you have found this episode insightful and gained a better understanding of the vital work school nurses do every day. Robin, thank you for joining me for this discussion.
Thank you for having me and for taking on these important topics.
Absolutely. To our listeners, if you enjoyed this episode, join Robin and I for episode 2, where we're going to take a deeper look at the emerging trends and continue to discuss issues impacting school nursing.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.